Do you snore? Do you know someone who snores? Most of us are familiar with the sounds of snoring, but snoring is not a normal part of life. It's estimated there are around 60 million men, women, and children in North America who snore, have sleep-disordered breathing, or OSA, obstructive sleep apnea, a more serious health problem.
I was having a hard time sleeping, tossing and turning, tired in the daytime, and I just wasn't getting sleep. And I went through about 3 or 4 different CPAP machines, and I could just not really get used to it. The mask one I couldn't handle at all. I am a side sleeper, and it would push it up and leak, and I was awake more than I was asleep.
If you've been diagnosed with OSA by a sleep specialist and traditional CPAP therapy is not working for you or is not an option, there is another treatment that works, but many people just don't know about it. Member of the American Academy of Craniofacial Pain and Dental Sleep Medicine, Dr. John Collister of Mountain View Dental provides another choice, an oral airway device. It's a simple, non-invasive therapy similar to a mouth guard.
Traditionally, people that have sleep apnea have been treated by a CPAP device. That involves the nose piece that's strapped to the head, long cord that's attached to an air compressor. The CPAP is 100% effective when it's utilized properly. However, studies have shown that less than 50% of the users are compliant after 90 days. That's why there's an alternative, the oral airway device.
There are about 100 different appliances approved by the FDA for the treatment of snoring and sleep apnea.
Oral airway devices fall into 3 categories: a palatal expansion device, tongue retention devices, and mandibular advancement devices. Basically, the mandibular advancement device works by allowing us to move the jaw in very small increments forward until the airway is open to its optimum position. These appliances are very easy to use and comfortable, so your compliance rate is over 90%. I use 2 of these appliances in my practice. One is the dorsal fin appliance. It's a mandibular advancement appliance that works by 2 plastic extensions on the side to keep the jaw forward. The other one is a modified sleep Herbst appliance, and it works the same way in keeping the jaw forward, only it uses a metal sleeve on either side. I love teaching people. A lot of times with dentistry, you get involved in just doing the routine things like fillings, root canals. With sleep apnea patients, you have an opportunity to teach them why it's important to treat sleep apnea, how it affects their health if they don't, and what happens when they wear an appliance that actually treats it for them so they can sleep better and feel better during the day.
About 7.5 hours sleep now compared to 5, and I'm rested. I don't fall asleep. I sit down, and I don't automatically go conk out. And, my energy level is high. It's very convenient. To travel with is just amazing. I don't have to travel with a CPAP. You go through the airport, they pull you out. They've got to unload it. They got to go all through it. You got it back on, you head out. This thing, they look at it, and no problem, and go through. I ride motorcycles, go on trips. I usually camp out. I take the airway device, and man, it works wonderful for me.
Mountain View Dental offers complete dental health, beautiful smiles, and healthy sleep.